Okay, retinoblastoma is a cancer that arises from the retina. It's caused by a gene mutation that can either be inherited or can occur spontaneously. So there aren't very many obvious signs. Sometimes there's something called a white reflex. When we're looking in that pupil with a light, we may see a little flash of white. That should always be referred for further assessment. Sometimes a child who did not previously have strabismus will develop it, and that's where their eye is moving. It's diagnosed by ophthalmoscopic exam. Ultrasound and CT are used then to determine the extent of the disease. So management of this, if this tumor is advanced, they actually just have to remove the entire eye. They do radiation, they do chemotherapy. They do something called plaque brachytherapy, where they have chemo implanted or in an implantable, just in a little implantable object, a thing with chemo. They can do photocoagulation, where they actually zap or decrease or eliminate the blood flow to the tumor. They can do cryotherapy that does the same thing. Nursing care, we need to have a high index of suspicion for this because it gets missed. Take reports of eye or abnormalities seriously. So if parents say, hey, I'm worried about our eyes, look at those eyes. This is most often diagnosed in infants, and so the preparation education is going to be directed toward parents. We need to give lots of emotional support. When parents are told that their child's eye is going to be removed, that's pretty horrifying and difficult for a lot of parents to deal with. They're concerned about their child being disfigured. We want to teach them how to take care of the socket. It usually needs to be irrigated while it's healing. They may need antibiotic ointment applied. Within about 3 weeks, they should be fitted with a prosthetic eye, and then we need to teach the parents how to manage that. And then we're helping them deal with the side effects of chemo and radiation. This is 95% survivable with early treatment. So that's a positive. Sometimes it also spontaneously regresses, but after treatment, they can develop secondary tumors. Remember that chemo and radiation both actually also damage cells, and so you can have a different kind of cancer come back after that treatment. It's also common for them to have visual acuity changes if an eye doesn't have to be removed, or if there's potential damage to the other eye. If they have retinoblastoma in both eyes, they're more likely to have other cancers. Okay, next we start talking about neurologic infections.